I am so pleased to welcome businessman and entrepreneur Mark Cuban to How Would You Fix It? Mark is probably best known to most people as a former shark on the TV show Shark Tank and the former owner of the Dallas Mavericks NBA team. But he's also the co-founder of the Mark Cuban Cost Plus Drug Company, which sells generic medications directly to consumers at transparent prices and big discounts. More recently, he's been talking about even bigger reforms to the healthcare system, which is why I am so excited to have him here. Mark Cuban, thank you so much for joining us.
Thanks for having me.
I'm curious, your background's been mostly in tech and in sports. How did you come to make healthcare such a priority?
I got a cold email from my now co-founder, Dr. Alex Oshmayansky, and he wanted to build a compounding pharmacy that made sterile injectables that are on the FDA short supply list, which it's crazy that there is a short supply list for generic injectables. So that was great, but it wasn't big enough. And as I looked into it, it was right around the time the Farmer Bro was going to jail. And I was like, how can this dude jack up the price of a generic medication to the detriment of so many people? And then it became obvious that nobody knew what a medication cost. Nobody knew why it cost, what it cost, and nobody understood why everybody paid a different price for the same medication. That led to us launching costplusdrugs.com in January of 2022, and it's just been growing like a weed ever since.
So you started with drugs, not because you thought that would be the best place or the easiest place, but that's because that's where you started, right?
Yeah, just for the most part, yeah. And, we wanted to change how medications were sold. And so we took the transparent path where for an industry where there was zero transparency. And so when you go to costplusdrugs.com and you put in the name of the medication, if it's one of the thousands we carry, when it comes up, you'll see our actual cost. And then you'll see we only mark it up 15%. We have a $5 fee for shipping and a $5 fee for the pharmacist who has to check the prescription. And in doing so, by only having a 15% markup, our prices were dramatically less expensive than, than everybody else's. And by being transparent, all of our patients started trusting us, right? Because, trust really is a formula. Trust equals transparency divided by self-interest. We were being completely transparent simply by the fact that we were showing you our cost and our markup. And when our markup is only 15%, that's not a lot of self-interest. Everybody else prices to the market. We priced to what we thought was fair.
For decades now, the big debate in health policy has been whether the system should be more run by the government or more run by the private sector. Is that even the right way to focus on this anymore? Now
No,
everything is sort of hybrid and a mess.
no, it's not. Because if the government doesn't have data and the government can't trust the vendors that they're working with, it doesn't matter that it's the government doing all the negotiating. And you see that in other countries. For instance, we get emails from countries around the world, from Canada, England, asking to buy generics from us because our prices for generics, particularly specialty generics, are less expensive than what they sell for in countries that have single payer or universal care. And so it really depends on, are those, governments working from appropriate data? And so in this country, we don't know what those costs are. And I'll give you the perfect example. Elizabeth Warren has made it her mission to try to determine what the government pays for medications for TRICARE for people in the military. And it's insane that if you are off base and go to a retail pharmacy, you pay more for certain generic drugs than you would pay if you go to Cost Plus Drugs. And to make it even more insane, when she tried to get ESI Express Scripts to share what they were charging the government for any medications, they wouldn't do it. She offered to go into a secure environment and said, I just wanted to see the pricing. She asked them the same question in a Senate hearing, and they said no.
And
I'm sure
TRICARE,
the
of course, is a
president asked.
fully government program. It's
Yes, it's
healthcare for the
fully
military.
exactly. It's fully a government program negotiated by the government. And the government even introduced specialty requirements in terms of the manufacturing, how it's manufactured, where it's manufactured, which just made ESI more money and made it more expensive for the government. And so while I'm not opposed to single payer or universal health care at all, and kind of the analogy I use is if healthcare costs $1 per person per year, yeah, great. Taxpayers would pay that, but it would be a set $1 and it'd be obviously inexpensive. But when you don't know all the costs, when there's no transparency, it's impossible to determine if it's a better solution or not.
Are there segments of the healthcare industry that would work better if the private sector ran them and better if the government ran them? I'm thinking, hospitals, doctors,
I don't
drugs.
think it's like that at all. I think it depends on how much transparency there is. The fundamental issue is transparency and trust. If you don't know, like there are a lot of hospitals, and you know this better than anybody, that don't know their costs. And if you just hire the same people and just say, look, we're going to pay Medicare pricing to Mayo Clinic, and Mayo Clinic doesn't know all their costs, or we're going to take an urban hospital and continue to pay them Medicare and Medicaid because that's most of their business, and they don't know their costs, they just know their cash balance. It doesn't matter who runs it. If we brought them on Shark Tank and they said, and we asked them, what are your costs for this, this, and this, and they didn't have an answer, or they used what do they call it, cost of charge or whatever, where
Charge
they just do a
masters.
comparison between their total, and charge masters, right? Which is like the retail price for drugs. But when hospitals do pricing or cost analysis, they do Medicare cost reports whose only mission is to try to get them reimbursed as much as possible from taxpayer dollars. And they do charge cost, not charge master, but it's your total cost over your direct revenue or your total revenue, which gives you a percentage, and they apply that percentage across everything as opposed to using actual costs. And because they don't have real costs, they don't know what a bill of materials is for a hip replacement. They use GPOs to negotiate the implants for orthopedic surgeries, and they own part of the GPO, and they pay a 3% fee for using the GPO. It's not run like a real business. And so when you don't run something like a real business, and whether it's the government or private enterprise running it, if it's the same people either way, you're going to have the same problems.
So what do you fix first?
Transparency.
I was saying, and how though? Because now we have, you're talking about the GPOs, the group purchasing organizations that are private, but they're often working for the government, and we
Right.
have the insurance companies that are working for the government. So who fesses up first?
You have to be able to publish contracts so that any contract that's signed with a federal agency, the federal government, a state agency, a city, not only are the terms of the contract published, but the prices are published. So that TRICARE would be required to publish their prices. By seeing the actual contract, you can see where the city state agency is getting ripped off. Because right now there's confidentiality requirements, and the provider, not the providers, but the the companies, like the big insurance conglomerates, they say, we can't do this. We can't show this it's proprietary information, which is nonsense. You've got thousands of companies. You've got hundreds of agencies and states and cities that negotiate the same contract. So lots of people know, but they do it to make it more complicated. And so as a result, nobody knows how the deals are structured. And if you don't know how the deals are structured, it's impossible to negotiate better ones. And if they'll sue you for discussing it with their peers, then it's like Fight Club. The number one rule is Fight Club is you can't talk about Fight Club. The number one rule of healthcare contracts is you can't talk about healthcare contracts.
Congress has passed laws. The president has pushed a lot of these transparency rules, and basically the health industry has said, yeah, sorry, we can't do it, or we're going to do it in such a way that you can't find it out anyway. We're going to
Correct.
send you reams and reams and reams of data, and you can go digging if you would like.
Correct. And so you take that to the next step. The big healthcare companies, first of all, they're vertically integrated. They have hundreds, if not thousands, of subsidiaries. People don't even know what the subsidiaries are when they do business with them, right? And so when that happens, there's just no way for any of the states, cities, federal government to enforce the laws. The big healthcare companies have more lawyers, move faster, are better able to find loopholes than the government and the agencies that enforce it are able to enforce it. And so what ends up happening, you see all these fines. This PBM, this insurance company, whatever, got fined for A, B, or C, and then they just go right back to doing business with them. Excuse me. So when I talk to governors, one of the first things I say in terms of reform is A, publish the contracts, and B, if you are doing business with a vertically integrated healthcare company and they are fined by any federal agency, any state government, they get one mulligan. If they are fined a second time, they can't do business with you for 5 years. That will act as the enforcement mechanism to keep them in line. And then the third thing that I always push is that anybody is able to go out and make a cash purchase, whether it's medical or pharmacy, as long as it's less expensive than their out of pocket, and have it by law count towards their deductible and max out of pocket. When you do that, you give them the opportunity to to shop when something is shoppable. Well, not everything is, but you give them the opportunity to shop, and that helps force down prices.
So I've been doing this since the 1980s, and it's always been the Democrats beating up on the big insurance companies and the Republicans basically defending them. Now the Republicans are beating up on the big insurance companies. Are we kind of inevitably going towards a government-run single payer?
No, like if you look at the Break Up Big Medicine bill that was introduced by Josh Hawley, a Republican, and Elizabeth Warren, to me, that's the first step. So the good news, it was introduced on a bipartisan basis, because if you break up these big, huge conglomerates, everything changes. The price of everything drops like a rock. But the problem is nobody else, no senators have supported it, and nobody has in the House has introduced a comparable bill. Everybody just chickened out. And so that's the first step. And like you see these reports on Medicare for all. Like there was one that just came out from Yale, which was kind of a joke, which is disappointing because I'd like to see real data, a real plan. But in that, I'll give you a perfect example. I just tweeted about it. In that Yale paper that said it would save them $1 trillion, right? Literally, when you go through the line items, it said that they would save $265 billion on fraud. You know how they calculated that number?
I have not. I've looked at the paper, but I haven't gotten that deep.
So when you look at the footnotes and the references, there was a paper written in 2003 about Taiwan and their healthcare system and the conversion in 1995. Well, Taiwan worked back then on a paper system. And Taiwan, in that paper, they said that they saved 8% of their total cost by going to a single payer system. So they literally said, well, if Taiwan, a country of 23 million people, who kind of a homogenous country, saved 8%, then the United States of America must be able to save 8%. And then another section was like, well, if we pay hospitals Medicare rates, because those everybody's bill will be paid, they'll save money there, which is true. And because more people will use care and will get paid. And then because their administrative costs will go down, which is true, then every hospital can survive at Medicare rates. Try telling that to Mayo Clinic. Try telling that to Stanford. Not all hospitals are the same. And they did no behavioral analysis in this study at all. They didn't talk to any of those CEOs and say, would this work for you? Or how can you get from where we are today to a place where you can design your hospital to support Medicare rates? Not one single interview ever. And so unless you do a behavioral analysis to see how it impacts all these different types of providers and quality of providers, it's kind of a joke, right? And so I've talked to Democrats who are for Medicare for all, and I'm not opposed to it. I even read what's his name, the Michigan, the guy running for senator in
Abdul
Michigan.
El Sayed.
Yeah, Abdul El Sayed. I read his book on Medicare for all, and it wasn't bad, right? But he even asked more questions than gave more answers. He didn't say this is what we need to do. Nobody's come up with a plan, you know. And what ends up happening, look at the ACA. When the ACA came up, they had the individual mandates. The individual mandates required everybody to have some form of insurance, which, leveled out all the participation and made it more affordable for everybody. And then the Republicans got rid of that, right? And then if it wasn't for John McClain giving a thumbs down, right, who knows what would happen to the ACA. And the point there is you have to get everybody involved. You have to put together a blue ribbon commission. And I hate commissions. I hate groups like that. But you have to do something where you bring in the CEO of Mayo Clinic. You bring in a research institution. You bring in people from KFF, right? You bring in from Kaiser Permanente. And you bring in from urban hospitals, ASCs, direct primary care. And you say, okay, guys, the mission is to find a solution so that everybody gets care. How is it that we can offer care to everybody in this country and doctors get paid enough to survive and pay off their loans? And the hospitals that have been run to be premium and work at the highest level can support everything. Like I was talking to a group, a family in Australia. Australia doesn't have photon radiation, I think it's called, right? So they have to come here and they have to figure out how to get it here. So we're connecting them with Baylor Scott White to try to provide this for them. But there's different decisions that have to be made. What are you not going to cover? And unless you get people from all perspectives so that if you come to an agreement, everybody will support it, then it's just going to be the same thing. And when you look at the legislation as it's written now by Representative Jayapal or Bernie Sanders,
The Medicare for All bill.
yeah, the Medicare for All bill, the administration part all says the exact same thing. At the discretion of the Secretary of Health and Human Services. Well, that's a political position. You can't have a political appointee running healthcare. So you have to come up with something that works for all stakeholders. And there's nobody on the Democratic side or Republican side for that matter who has done anything to that effect. And then the Jayapal Medicare for All says, well, in 2 years, we'll do this, all has to happen. And Bernie says in 4 years. Ain't no way that you can make a transition like that. And so you have to also be reasonable and honest and forthcoming. And it's just political sloganism. And let me be clear. I'm not against Medicare for all. I'm not against single payer. I'm not against universal health care. But you have to realize all these other countries that have evolved to it did just that. Some started over 100 years ago. Taiwan started 30 plus years ago, right? I think Israel about the same. 30 plus years ago, there weren't MRIs everywhere. And when you look at every Western nation that has any form of universal care, they have to make decisions that are driven by the cultures of the country. We're not the type of country, I don't think, that is going to let somebody decide that we're not going to invest in photon radiation when somebody's already invested in multiple places. There's lots of places you can get photon radiation. You don't see that in other countries. We just have a different attitude. We want to keep our loved ones alive till the last possible minute. You don't see that in other countries. That's a cultural difference. And so until we start to address those differences, we can't say, let government take over. We can't say, all right, this is going to make sense. Put aside the economics. Put aside that we don't know the cost. Put aside that we have no transparency. All those things are important, but making sure we have healthcare for everybody is more important. That's the difference. I think, that's also should be an American dream. As an entrepreneur, I'm a big fan of the American dream, but being able to be healthy and not be afraid that you can't afford what you need or your family needs, that's wrong in our American dream. And, when we talk about healthcare as a right, doctors freak out because they presume that they're going to be paid Medicare rates and they lose control of their life, right? And they talk about opting out and not doing it, And so you need to get all these stakeholders accounted for. And until you start to do that and put together a plan that people will accept, we're not going to ever be in a position to take care of people like so many of us hope to do.
And yet that would require both parties to basically lay down their arms.
Yes, which I think is possible. I think it's doable because the number one thing that in every poll, people are concerned about healthcare costs. It's not the quality of healthcare. Nobody really complains about the quality. Our doctors are great, our systems are great. It's the economic side. And who defines the economic side? Those humongous healthcare conglomerates. And what's the best way to get to a point where we have transparency at the contract level, um, you know, flexibility and understanding, et cetera, all the things I mentioned? You break up those huge conglomerates that have thousands of subsidiaries that do 150 plus $billion in intercompany transfers that game the medical loss ratio. I mean, all these things happen because those big companies have more control over the economics of our healthcare system than the government does.
I hope we actually get to that point, and I hope you're around to help with some of these stakeholder
Oh,
conversations.
hopefully I'm not going anywhere.
Thank you so much.